This is Counterpoint, and I'm your host, Tanya Granic Allen. Canada's publicly funded healthcare system is now the site of a significant legal and ethical confrontation. On January 12th, 2026, a court case began in British Columbia that could determine whether every Canadian medical institution, including those with religious affiliations like a Catholic hospital, for example, must be required to provide medical assistance in dying. Again, that word for euthanasia, MAID, and whether they can do it and must do it on site. The plaintiffs, including the family of a woman who was transferred from a Catholic hospital to another facility to receive MAID, argues that access to the procedure is a constitutional right that cannot be denied or deferred. Their legal challenge invokes protections such as life, liberty, and the security of person under Section 7 of the Charter, setting up a dramatic clash between access rights and conscience protections. Religiously affiliated hospitals, like Vancouver's Providence Healthcare Facilities, currently operate under agreements that allow them not to perform MAID within their buildings while still referring and facilitating transfers to nearby locations. This arrangement has sparked intense debate about how far public health systems can go in accommodating conscience rights without infringing upon access for patients for their lawful services. The outcome of this case will obviously have far-reaching implications for both the Canadian Charter of Rights and Freedoms and the structure of the country's healthcare landscape, potentially reshaping how conscience, public funding, and patient choice intersect. Well, to unpack the legal, moral, and societal dimensions of this pivotal case, I'm joined by Alex Schadenberg, Executive Director of the Euthanasia Prevention Coalition, and he's a longstanding voice on MAID policy and conscience rights here in Canada. Alex, thank you so much for joining me today.
Yeah, Tanya, it's a very important topic. Thank you for having me.
Yeah, so just before we dive into this case, why don't you bring us up to speed as to where the law is with MAID in the country and what are the numbers?
Oh, well, first of all, the numbers are always delayed because the federal government decides that it takes forever to release data. But anyway, we had supposedly 16,499 euthanasia deaths in 2014 in Canada. And that represented 5.1% of all deaths. But it does vary widely across Canada because British Columbia and Quebec are by far the highest percentage. So, for instance, Quebec had 7.9% of all deaths
Oh,
being
wow.
euthanasia. And you see that variance between, Manitoba being much lower, Ontario being sort of in the middle. Nonetheless, we see that euthanasia really has become commonplace within our hospitals, etc., system in Canada.
Okay, question on that though. The spectrum of numbers. So why are, I think, British Columbia, you said, and Quebec, why are their numbers higher? Do you have any indication as to why that would be?
Well, first of all, Quebec has a different law than the rest of Canada, and you probably realize that there's two euthanasia laws in Canada. There's the Quebec law and the regular law that was for the rest of the country. The Quebec law is even more permissive. Plus, the Quebec culture seems more permissive. Plus, the Quebec government passed a bill a couple of years ago which expanded euthanasia much further. So they already have, sadly, already have euthanasia by advanced request. They have every single healthcare facility in Quebec must provide euthanasia, which is what this court case is about in Vancouver. And they've really, I would just say, drank the Kool-Aid, where they actually had one region of Quebec that had 13.4% of all deaths. So you get this massive shift in this culture towards this becomes the way to die, that lethal injection of poison becomes the way to die rather than natural death with caring for pain and symptoms.
Oh, okay, wow. I'm sure for many of our viewers, they are surprised to hear there are two laws because Quebec has its own, as you mentioned, more permissive than the national
Right.
law. Okay, interesting.
Yep.
So you mentioned that there are no conscience or religious exemptions for healthcare facilities in Quebec. Quebec,
Correct.
historically Catholic province, settled by a lot of the nuns who are running these hospitals. So all hospitals in Quebec have to perform MAID.
All hospitals, all hospices, absolutely, they must. In fact, there was the St. Raphael's Hospital in Montreal. You might remember that. That was the one that was built by the Archdiocese of Montreal. It was a former church that they converted into a hospice. They signed a 99-year agreement with the Quebec government in 2016, saying that they would not in any way provide MAID euthanasia, and that was agreed to. But then, with the passage of the Can't remember the name of the bill, but anyway, it was, I think, Bill 11 or something. Anyway, it was that was in 2023.
Right.
That forced that every institution must provide euthanasia, including St. Raphael's. There were also some
Okay, I'm going to
hospices that
pause you
didn't
there
provide
and
euthanasia.
we're going to pick this up in
Yeah.
just a moment.